The opaque news. Hello and welcome to my channel, and for those of you who are returning, welcome back. Please like, share, and subscribe. It's free, and do consider supporting our GoFundMe. This article comes to you by way of Yahoo News. This article was written by Chanel Wright. Mental health ER visits among children rising. Experts point to a broken system. Multiple emergency room visits for children experiencing mental health crisis are on the rise, according to a new study. Experts say that a broken system is to blame. The study, published in the journal JAMA Pediatrics in December, looked at more than 200,000 patients between the ages of 3 and 17 who visited an emergency room with a mental health concern across 38 U.S. hospitals between 2015 and 2020. Such emergency room visits increased by 8% annually, according to 300,000 visits that were assessed. The number of revisits increased by 6% annually. Young patients with psychotic disorders such as schizophrenia were 42% more likely to revisit the emergency department within 6 months, according to the study, with 13.2% of the patients having a mental health revisit within 6 months. The psychiatric emergency room can be a lifesaver for young people who are acutely suicidal. Dr. Harold S. Koppelwick, president and medical director of the nonprofit Child Mind Institute, said in a statement to Yahoo News. This study speaks volumes about the lack of school-based or outpatient programs. The system is broken. The study points to overwhelmed caregivers of young patients with behavioral or psychological disorders who are increasingly relying on the emergency room for care. Families come in with their children who have severe behavioral problems, and the families really just are at their wits' end. Dr. Anna Cushing, a pediatric emergency room physician at Children's Hospital Los Angeles and a co-author of the study, told the New York Times. Their child's behavior may be a danger to themselves, but also to the parents, to the other children in the home. When a child is having a meltdown or is in crisis at home, a lot of them don't have a child psychiatrist to call to get advice on or to bring them to see the next day. Michael Inkenbach, a psychiatrist and the clinical director of the Child Mind Institute, told Yahoo News, oftentimes it's just a cycle of behavior disorders at home. They come to the hospital, they're fine. Then they get discharged. Then the whole thing happens a couple of days later because they don't have access to care. So parents' only option, if they're feeling unsafe, is to go to the emergency room. There's no Bible on parenting, so when you have a kid who's really challenging, it's hard to know what to do, added Nkaba, who has also worked in behavioral emergency rooms for children for 14 years. ERs are too busy already, especially with COVID and everything. They're not really equipped to deal with kids. There's child psychiatrists on call for the ER, but they get really stressed with a kid having a tantrum or having an episode, and they don't know what to do. Our ER doctors don't know what to do. Pediatricians don't know what to do. It's hard because it's really disruptive to the entire emergency room. According to the Child Mind Institute, whose teams of psychologists and other specialists offer evaluation and treatment for a wide range of conditions and concerns, about 70% of U.S. counties do not have one child and adolescent psychiatrist, and that the average time it takes between the onset of symptoms and treatment is over 8 years due to stigma, misinformation, and lack of access to care. It would be helpful to train pediatricians more in mental health so they can address key issues in these patients, Inbach continued. Currently, pediatricians get very little training in mental health. We need to find a way to educate the population, get more providers out there, get more child psychiatrists through medical schools, hire mental health professionals, and educate pediatricians and doctors better. He added that improving collaboration between pediatrics and mental health is also important. That's getting better, but we still have a long way to go, he said. The study highlighted Inbach's observation, signifying that the trend surrounding the problem of increasing mental health emergency room visits has not abated. Improved intervention services for patients with a behavioral health crisis are needed on a hospital and systems level to reduce pediatric mental health emergency department use and ensure access to appropriate follow-up care with a particular focus on those patients most likely to revisit, the study's authors concluded.